Okay. So, hi everybody that is here. Thank you for taking time out of your day and evening to show up tonight. It's much appreciated. For those of you that don't know me, my name is Jordan Scott, and I'm the regional field organizer for the Pennsylvania Harm Reduction Network, which is a new-ish statewide advocacy organization focused on changing policy in Pennsylvania. So I'm going to introduce our guest, which is Trisha Christensen from the Community Education Group. We had connected with Trisha a couple months ago, particularly around the issue of all the various settlements, and talked about the need for the community to be able to have a say in how money is spent, to understand the process, understand how things are supposed to work, be able to problem solve if there are issues in counties, and also, together collectively put our heads together and figure out, what is that Pennsylvania wish list? So with that, I'm going to turn it over to Trisha.
Thank you. Hi, everyone. Nice to meet you all, kind of. Nice to be here. I do have this PowerPoint presentation. I promise I'm not like a read from the PowerPoint type of person, but I know it is helpful to have some visual aids, and there's going to be a lot of like text information in there. And this will be available to you all afterwards, along with the recording. So I'm just going to kind of jump right in. Quick housekeeping of just like what we're going to be covering today. I'm going to do sort of a broad overview of what the opioid settlements are generally, but then we're going to deep dive into Pennsylvania. As you all might know, like every state is managing their system differently. So if you're doing this broad overview, it can really get caught up in like, but what about here and what about there? So we're really going to be able to dive into what Pennsylvania is doing and what we know so far and sort of where the opportunities are for advocacy. We will have plenty of time for Q&A. I welcome questions throughout the presentation as well. My colleague Lavina is here to help out in the chat. She'll highlight any questions that might need to be answered right away. Or, if there's questions at the end, we can do kind of a longer Q&A too. And then, as Jordan said, we have a little extra time tonight, so we should be able to get to this like PARN wish list or some kind of like action items that you all want to focus on, things that you would want to see opioid settlement spending spent on in Pennsylvania. So without further ado, I'm gonna get going. So in case y'all have no idea why we're here, what is the opioid litigation? As you may have heard, there were thousands of state and local lawsuits throughout the country against various like big pharma organizations. And this is a mixture of manufacturers, distributors, and retailers. So there's a lot of these little lawsuits going on, and many of them were turned into these like larger lawsuits. I am not a lawyer. I should have started with that. But I'm more of like on the policy side of things. So any like legal language I have learned from people who understand law more than I have. So don't ask me technical questions. But basically what these lawsuits had done is it was litigation for a variety of things. Some of the three biggest categories were aggressive marketing of OxyContin or marketing for off-brand uses. That was sort of like the legal reason, for bringing the litigation ahead. Deceptive business practices, so actual lies about the risk of addiction, withdrawal of opioids. And then this may have come in the terms of like fake advertising, misbranding, or deceptive marketing. And then particularly for the retailers, a lot of the litigation was around lax monitoring of suspicious orders. So like, an order would come in for some large amount and they just kind of like let it slide rather than maybe making a report about it and being able to stop some of this from the beginning. And we're interested in all of this at Community Education Group because we work throughout the 13 states of Appalachia. And as you all probably know all too well, Appalachia was really the ground zero for a lot of this overprescribing or aggressive marketing of opioids when all of it started. Of course, it became much of a national issue. So the settlements themselves all 50 states, plus Washington, D.C., plus U.S. territories, plus tribes and tribal health organizations, they are receiving settlement money in some form. This pot far exceeds $50 billion at this point. But then again, what that looks like kind of trickling down is a little bit different at different places. You all may have heard of the national settlement, and that's sort of the broad name for it. And this does refer to a specific thing. So it refers to this large settlement of $26 billion that's going to be paid out over 18 years. It is front loaded, which means that most of it is going to be paid out in the first few years, but it's going to slowly have some slow trickles throughout the 18. 46 states are participating in that. The 4 states that are not participating are just sort of have their own unique litigation strategy, but they are, most of them, still getting funds from the same defendants. They're just getting it separately in different ways. The defendants on this one are the big 3 distributors and then 1 manufacturer. So sometimes you might see it written this way of like the McKesson, AmerisourceBergen, Cardinal Health, and Johnson & Johnson litigation, or what have you. It goes by these different names depending on who is covering it, how much detail they are giving. This is the largest settlement. So that's the one that we hear about a lot. And as we will talk about in a moment, there are some certain rules that came along with that settlement that is creating the system for how a lot of the states are managing their opioid settlements. And just for your information, there are these additional settlements. I may have missed some on this slide, but these are ones that I'm aware of. Not every state is a part of all of these settlements, but you might see, you might see that Pennsylvania is a part of X, Y, or Z. I would be remiss to not note that most of the information that I have gleaned, especially in the beginning about the settlements broadly, came from opioidsettlementtracker.com, which is run by Christine Minhee. If you really want to do a deep dive, it is full of information, tons of commentary, tons of links to further information, deep dive Q&As. Pretty much every question you could ever ask is probably on her website. You just got to dig for it sometimes. But again, every state has a different process for how they are managing their settlement funds. So that's why we're here today, is to talk about Pennsylvania specifically. So you may be familiar with the 1990s tobacco litigation. And this was sort of a lot of lessons were learned from that we have taken now that we have this big opioid settlement. So in the 90s, we had this big tobacco litigation and there weren't really many rules put on it. And what happened later on, they realized is that like very little amount of that money was actually spent on anything related to what we might call tobacco remediation, right? Or like the harms of tobacco use. And there's been a lot of reporting on that, a lot of papers written over the years, and folks who are involved in the opioid settlements realize like that's a big problem. And we really need to put some guardrails on this opioid settlement money to make sure that it's actually used as intended. So there are some broad guardrails. All states, and again, this is regarding the national settlement money, but other settlements often are applied in the same way, but they might not have the exact same rules. But for this national settlement funds, all states are required to spend at least 70% of their funds on what's called future opioid remediation. And we can get to that, kind of what that means. Of that remaining 30%, 15 of it, so half of it, has to be related to opioid crisis. Half of it can be a maximum, half of it can be a reimbursement for opioid related expenses. So saying like, over the last decade, we've had XYZ expenses and we just want to sort of fill our coffers, but this is the justification for it. The other half of it can be just unstructured, like non-opioid remediation expenses. So maybe we're paying for law firms, maybe they're just using it to pave roads or whatever slush fund activities they want it for. So 85% of the money has to be spent on opioid related issues, but even then most of it has to be on future remediation. So that means that we have to look ahead. States have to look ahead at this money. They can't, again, just fill their coffers based on all the charges that they've paid over the years. The other thing that's interesting about these funds, especially for those of you who might work, many of you I assume work in the behavioral health field, at least broadly, and you maybe are familiar with working with federal grant money. And there's a lot of red tape with federal grant money, right, about how you can spend it. And some of that is good in the sense that there's congressional oversight. So if money is spent really poorly, Congress can come back and say like, hey, we need an investigation on this. We need you to send some reporting on this. And there can be some real teeth to how they're overseeing that. But on the other hand, as many of you I'm sure are familiar, you cannot use federal funds to buy syringes because there are certain federal laws that prohibit things like that. So with this money, there's no congressional oversight. So that leaves us in kind of a different situation as far as how to monitor these funds. But there's not that same red tape around buying syringes or other things that federal funds maybe can't pay for. So it gives us this like interesting, different injection of funds into our funding ecosystem. Exhibit E. If you are not familiar yet, I encourage you to look up this Exhibit E, the list of opioid remediation uses of funds that are approved. Again, this is specific to the national settlement funds, but many states have adopted this list or a very similar list for all of their opioid settlement spending. And what this is it's many pages long, but this is sort of an abbreviated version, is lists out things that you're allowed to use this money for. And as you'll see, there's some really good stuff in there, especially for harm reductionists, like naloxone is specifically mentioned, syringes is explicitly mentioned, the words harm reduction are explicitly mentioned. And then especially in the Schedule B approved uses, it talks a little bit more about like populations that we might want to focus on, or kind of broadly the things that this funding can go toward. This list, however, it's so broad that you can kind of get lost in it. And it's to some extent that it's easy to make an argument for what you want to pay for would fit into one of these buckets. So that's where at the end of this talk, we're going to talk a little bit more about like what's right for Pennsylvania and for your community, because that might look a little bit different than in other states or other local jurisdictions. But again, if you see a jurisdiction spending on something that doesn't seem to go in this list anywhere, then that's a red flag, right? Like they really need to be able to justify that their spending is in line with this list of approved uses. So it gives us a tool to work with. In Pennsylvania as a state is on track to receive over $1 billion just from the national settlement alone. So that's not counting all those other little settlements that Pennsylvania might be a part of. And the way that the state has decided to break up its funds is actually very nice compared to those guardrails we talked about, because it's right along those lines. 70% of all the funds are being given directly to counties. 15% is given directly to litigating subdivisions. So that's the local jurisdictions that were originally giving litigation. They sort of added in this 15% as like you did a little extra work in the beginning, so we're going to throw you a little extra money. And then the other 15% is just going to go to the Commonwealth, and it will be appropriated by the legislature for opioid-related expenditures. So based on that, this is my assumption. My assumption is that 70% of funds given directly to counties is going to be mostly for future opioid remediation uses. Potentially, they might allow for some, back payment. And that 15% to the Commonwealth, it is in law that it has to be used for opioid-related expenditures. I don't believe it says if it has to be future, so it could be that it's past expenses as well. And then my guess would be that 15% given directly to subdivisions is unrestricted. I could be wrong about that. This is me just sort of guessing based on how this is written out. But unrestricted meaning they could just sort of throw it into their general fund and use it as they'd like. There also, I should say, like there probably are folks in the audience today who know more about this than I do. Please feel free to share in the chat, share in the Q&A if you know something that I do not know. Just maybe you work with DDAP or in the field or something like that. You very well might know stuff that I don't know. So the body that is in charge of these funds in Pennsylvania is with this Pennsylvania Opioid Misuse and Addiction Abatement Trust. And this document, which again will be shared with you when we share the slides and the recording, if you aren't already aware of it, is this PA Intrastate Opioids Trust Order Allocation document. At least that's what I call it. Rolls off the tongue. This group of folks are responsible for distributing and allocating the funds from the national settlement. And again, I'm not sure if that means that they will also oversee funds from other settlements. I would guess they probably will, but I could be wrong. They are tasked with reviewing expenditures by subdivisions, which of course is a fancy word for like cities and counties, and to ensure that that spending is consistent with Exhibit E. So they have a role of oversight here. It's governed by a 13-member board of trustees who are all unpaid volunteers, and we're going to talk more about them in a moment. And they're required to meet at least 4 times per year. And it's my understanding that they are not required to meet publicly. So they might still make their meetings public, but I don't believe that they are required to. This quote I pulled that I thought was interesting. It said, "No subdivision may challenge another subdivision's use of funds, but subdivisions in the same region are encouraged to coordinate their use of funds." So if my county thinks that your county isn't using their funds correctly, I can't challenge that. However, the trust could, right? So I'm still a little unclear of like what that mechanism might look like as far as holding people accountable. But I thought it was interesting that was specifically in this document. And again, it does say they're encouraged to coordinate the use of their funds. So we are seeing that in a lot of states, that folks are encouraged to do some like regional planning and regional use of these funds. Because once it gets split up among all the jurisdictions, it might not actually be all that much. The question I always get from folks is like, what's the accountability? How do we hold these folks accountable who are in charge of all this money? So this is what's in law, what's in the document. Maybe not in law, maybe it's a legal document though. Each county has to submit a report every year, which will show actual expenditures of funds and the amount of funds received but not spent. And then the trust has to prepare an annual report, and that report shall be made public. Not sure when. Sometimes with these government reports, it's many months later they're made public. Sometimes it's right away. So we will have to see. And then there is a little bit of teeth here as far as what could happen if some counties are misspending. So if a county or litigating subdivision is spending funds in a way that's not in accordance with Exhibit E, or if they fail to provide the report, then the board of trustees can withhold next year's payments. And they give them 3 months basically to rectify those mistakes. And if after 3 months they have not done that, then the board may reduce or withhold payments going forward. And that money would be reallocated to the Commonwealth account. So again, the Commonwealth account then will be allocated by the legislature, appropriated by the legislature. So in some states, we see even less accountability measures built in than we do here. So this is a positive in my mind in Pennsylvania, that there's at least a little bit of a mechanism here to make sure counties are spending their money correctly. Okay, Board of Trustees. There's a lot of text on this page, but I just wanted to show you that it's written out really explicitly of who those 13 people are. And they have all been appointed, which I have on another slide. But you have a chairperson, and then you have the secretary of one of the Health and Human Services agencies or their designee appointed by the governor. And then you have 4 legislative members who are appointed by specific people. And then we have, how many is that? 1, 2, 3, 4, 5, 6, 7 regional trustees. So that's someone from Philadelphia, someone from Allegheny County, and then someone from the 5 different regions of the state. And what's important to note here is that some of these folks have term limits. So those legislative member trustees have 2-year appointments, but they can be reappointed with no limit. Those regional trustees, it's still a long time, but they have 2-year terms. They may be reappointed 3 times consecutively and may serve a maximum of 10 years. So maybe they're appointed 3 times consecutively and then they're not, and then they can come back for a couple more years. And it's really explicit what qualifications that these regional trustees must have. And I share this for a couple of reasons. Number one, you probably notice that most of the people on this list are professionals. They are folks that might not have lived experience, but they feel they have some expertise in this area. But there is an explicit bullet point here for individuals in recovery from substance use disorder, and then parent or guardian of someone who has had opioid use disorder. Obviously, some people on the board could have multiple of these things. Maybe they are a nurse and they are a parent of someone who's had an OUD. We are seeing in many states that these various advisory boards are made up mostly of professionals, not very many people with lived experience. Those of us in the harm reduction field all agree that's bad, and we would like to see that different. At this point in the process, it's probably a little late to change this kind of like in these legal documents, what the requirements are, but it does not mean it's too late to change how these boards can look over time. Again, even if they have been fully appointed, they have term limits. So there's a lot of work that can be done. I've also seen in some places, they've like passed law to update these documents to say that, to add on a certain number of people that fill a certain number of roles. So there are opportunities for things like that if it's something that you think is an egregious error. But many of you in this call probably fall into one or more of these buckets too. So keep that in mind. Pardon me. So here on the far right of this, we have our list of the 13 board members who have all been appointed now. This was just announced, I think, a week ago. I am not in the weeds in Pennsylvania, so I don't know many of these names. You all probably know some of these names and probably have some feelings about them. But it's just good to know, like, these are the folks in charge right now. These are the folks that you might want to be reaching out to if you have opinions about how this funding should be spent. It's unclear at this point if there's going to be any kind of RFA process. Well, that's not true. We'll get to that. There's some RFA process like through DDEP. But I don't know that talking to these folks individually would help you there or not if you're trying to find funds for your program. But it's still good to know who's involved here, who might need a little education. If you are, depending on which region that you live in, these regional trustees are representing you in this case. These legislative members, they are literally elected to represent you. So these are folks that you have some power over having discussions with. All right, we have a couple of slides here. Again, these have a lot of text on them, so I'm not going to read them, but I just wanted it to be available for you all so you can review it later. We have a few slides here about what we know so far. So I kind of break up Pennsylvania into state money and local money. Remember that state money is the 15% of the Commonwealth Fund that the state legislature is in charge of distributing. So DDEP has put out a couple of opportunities already, including $9 million to expand crisis stabilization services and the funding through its SUD loan repayment program, which is my understanding that already existed, but this is sort of an extra injection of funding there. And then the Wolf administration announced some grants funded which is specific to working in communities of Black, Indigenous, and people of color. So these are 3 opportunities that I know have been announced. I'm sure there will be more. You all maybe know of some others that I don't know of yet. I've become very interested in how local jurisdictions are spending their funds throughout every state that I'm monitoring. In Pennsylvania, it's particularly interesting because most of the money is going directly to counties and cities. So they really have all the power in deciding how these funds are spent, how they're spent locally, how they maybe are pooling resources. So here's a few examples that I have found really interesting. Some folks, again, they're talking to their neighboring counties because maybe these are smaller counties, are not getting a huge percentage. And so they're discussing how to pool those resources. Delaware County has said that they're setting up a task force. So they're going to have like a local advisory board of some sort to decide how to spend this money. Lancaster County already approved some amount of money specifically for this pilot program. The Bucks County put out this really specific 18-year month roadmap, with really specific goals of how they're going to spend their money. So it's interesting to see, right? Like Bucks County versus Delaware County, that they were like, okay, let's set up a task force now to figure that out. Other counties probably, they already had some of that infrastructure, and so they already had these ideas in place. A couple other examples. York County, they're going to have like an RFA process, which that grant process is currently open if you live or work in York County. Northampton is using a lot of their funds for a fentanyl awareness campaign, which, as Jordan has pointed out to me, has a lot of misinformation on their website. So that's something where, like, if you live or work in Northampton County, like maybe you want to reach out to folks and, say, hey, like this is how our funds are being spent. I'm concerned about XYZ, and maybe there's an opportunity for education there. Cumberland County has been really specific about using their funds for providing Vivitrol to folks incarcerated in the county prison. It was my understanding in reading through that they were only providing Vivitrol. They're not providing methadone or buprenorphine, which, as we know, are more effective than Vivitrol. And Vivitrol does have some increased risk for overdose. So I have some concern there. And then Sullivan County is another example where they are working mostly in the prevention among high school folks in the school district. Last thing I did just want to note here, there were 3 Pennsylvania leaders who were selected for this Opioid Solutions Leadership Network. So this is a national cohort that I believe will have new folks every year or every couple of years. But these are folks who are going to be getting some extra information about proper ways or most effective ways to use opioid settlement funds. So these could be folks who really have your ear if you were interested in having conversations about this. That's why I shared this slide. All right, I've gone over this a little bit throughout. I just wanted to make it clear that there are a lot of advocacy opportunities here. And I think talking to folks, if you all work in more local harm reduction settings, like we're always frustrated, right? Like funding is hard. It seems like the big players always get the funding every time. It feels like the infrastructure that you currently have is certainly going to impact how the money is spent. Syringe service programs are not legal in all of Pennsylvania. So you're going to be hard pressed to find a lot of counties spending their money on syringes, even though they could. But this is an advocacy opportunity. And again, this is an 18-year process. So there's a lot happening now, but just because some bad decisions might be made in the first year doesn't mean bad decisions are going to be made for 18 years, especially if folks can speak up. So again, breaking this into like state level and local level. At the state level, again, it's unclear that the trust meetings are going to be public. I have a feeling they will not be. But hopefully there might be some coverage of it or some press releases or something that you're able to respond to. I am not so familiar with how DDAP works and what opportunities there are, but DDAP is intimately involved in a lot of this decision making. So any context that you have within DDAP, it's very worthwhile to be reaching out to them and asking about opioid settlements. It's very possible to get your folks appointed as regional trustees. So, figure out what that process looks like in your locality and get some folks, get the ears of the right people, get some folks, in front of people who can have those conversations about, like, I would make a good trustee for these reasons. The trustees that are currently appointed, talk to them, especially those legislative members. Again, they are elected to represent you. And then at the local level, what I think is most important and probably where you have the most impact is go to your local public meetings, go to your city council meetings, go to your county commissioner meetings. If it's on the agenda, even better, right? You can like really respond to a discussion that they're having about opioid settlements. But even if it's not on the agenda, like they probably have room for public comment. So just show up, take your 2-3 minutes and say, hey, I'm a resident. Here's how I feel. Here's how I think that our funding should be spent. Some of these jurisdictions have their own advisory committees, or maybe they have some kind of health committee or something where like these decisions would be made. So find out what those committees look like, find out if you can be a part of them or how you might be able to influence them. And then good old letters to the editor, I really think can be very powerful. If you name a legislator or a person in charge, it can really get their attention. Name your county commissioner. Any kind of press coverage that you can get, whether that's PARN doing some action or you and your local county doing some action, getting some media coverage of this. And I think my advice to you all is to really go into these conversations with what does your community need? We already have Exhibit E. Exhibit E is this broad list, and all of these county commissioners and other folks in decision-making positions, they know that Exhibit E exists and they know that they have to stick to it. But Exhibit E does provide a lot of wiggle room. So what exactly does your community need? Don't just say we need to be spending more money on harm reduction. Say specifically, like we need to be purchasing these things. We need specific kinds of transportation support. We need funding for bringing on this kind of person onto our team. Being really specific like that gives them a better understanding of what's really needed, what the infrastructure currently looks like, what gaps there are. And I will just end here. I am going to take the PowerPoint down, but again, you're going to have this information. I think Lavina's probably been sharing in the chat a few things about CEG. So we do have a listserv called the Appalachia Opioid Remediation Listserv. And this is where we share updates about all 13 states of Appalachia, how they are managing and making decisions about their opioid settlement funds. So Pennsylvania is on there, of course. And then I think it's interesting to see how your neighboring states might be managing their funds and maybe how that's different. Maybe it's a point of leverage, or maybe it's just sort of interesting to see the differences. We also have a database that we've recently launched where we are sharing, like we're literally trawling through county council notes and finding information about how those various counties have been spending their funds and trying to include that information in the database so that you can, if you can look in there and say like, oh, my county made this decision already on how to spend this funds. Maybe I want to praise them for that. Maybe I want to reprimand them for that. But now you have that information if you didn't already. It is not fully comprehensive, but we're working on it. And if you have any specific requests of counties to cover, please let us know. And then we're on social media, CEG and WV. I should say a lot of our on the ground work has been done in West Virginia, but we do work again regionally throughout Appalachia. I've been talking forever. So I am going to turn my screen off. I see there are a ton of things in the chat that I have not been looking at, and I would love to see if there are any questions, any comments. How do I stop sharing? There it is. All right. Lavina, are there any questions that came across?
The one thing I was going to say, Jordan, you were muted for a second there.
There we go. 3 years later. All right. Yeah. So any questions people have about statewide things specific to your respective county? And if not, then we can, probably, dive into like what does the Pennsylvania wish list look like, and also in your county, like what does that list look like for in your county? Yeah, Kate, go ahead.
Yes, I'm sorry. I was trying to get off of mute. So I have a question. I'm sorry, I missed the first 10 minutes. I was driving home. I live in Luzerne County, which is like the northern part of Pennsylvania, northeastern Pennsylvania. And a couple of the people I talked to, a lot of the money has been earmarked for like law enforcement efforts, like bulletproof vests, firearms, hiring another police officer. And like from where I'm sitting as somebody in harm reduction, I don't feel like that's the best use of the money. Um, I might have missed something, but can they pretty much like, as long as they put a spin on it, that it's to like combat like fentanyl use, can they pretty much like put it wherever they want to? Like in my county, from what I've seen, the SCA has a big hand in it. So I was just wondering, like, if there's any, like, if there's anything they can't do with it.
It's such a good question. This was someone from Virginia, but he had a really good quote. He's on their like advisory board, and he was saying that they were getting a lot of requests from law enforcement. And what he said is like, we are not in the business of funding law enforcement. We are in the business of funding opioid remediation efforts. But with that said, law enforcement could be doing opioid remediation efforts. And I think that this is a big issue with how all of this has been structured, that it's not specific about who gets to decide what is opioid remediation. So if your county commissioners truly feel that purchasing bulletproof vests is opioid remediation, and this board of trustees agrees with them, then they could potentially get away with it. There's not like one person that gets to decide for sure. So this is a political process. And that's where I think that your voice in this is so important, that you should make the argument that this is not opioid remediation. I think every single dollar of this opioid settlement funds needs to be explicitly linked back to that Exhibit E. So I think the onus is on them to prove that those expenses would count. I hope that answers your question.
But that's the thing, if they're able to put a spin on it and they have the right people, like the county commissioners, all aligned in the right way. My county's very, very political. We're known for like Kids for Cash and kind of doing things in a crooked type way. So if they put the right spin on it and they have all their like political allies backing them, there's really, other than being an advocate and speaking up against it, then they are well within their rights legally, correct?
Yeah, if they can convince the right people, and that includes the board of trustees, because the board of trustees is going to be, in charge of making sure this money is spent correctly. So depending on how that larger group of folks is swayed, they could be well within their rights. Do you want me to call on folks, Jordan, or did you want to manage?
Yeah, sure.
I see Franca.
Hi. So I'm up in the central region of the state, more so like kind of north central. And what caught my eye was your slide, because Union County was at the top of your list, followed by CMSU, and those are our counties. So like Columbia, Montour, Snyder, Union, we have 4 counties under one SCA. And we have a warm handoff that comes out of that FCA. So I know those folks, and I guess to get to the question. So what I saw in your slides was Union County didn't care for the way things were being handled by the United Way. And they also didn't like the way, they didn't feel that CMSU was doing a great job. So if they're not happy with the SEAs in their region, who then, like, because what I hear is the monies are getting channeled through the SEAs, but if they're not happy with the SEAs, wow, I don't want to believe that they're going to try to come up with something on their own. based on, no knowledge. But anyway, what would they do? Who would they then channel that money through to develop these types of programs?
I'm so glad you asked that question, because that gets at the reason that we at CEG started this database is the realization that this money is going, the money that's going directly to counties and like local and cities, it's going to the county and the city like any other funding mechanism. And so when we've been watching through these like county council meetings, these are your county commissioners making any kind of budgetary decision that they make every day. They're talking about American Rescue Plan Act funds, they're talking about COVID funds, and they're talking about COVID settlement funds. So some counties, I think, are doing what I would consider the smart thing, but I am only myself, which is working with their local health authorities or their local SCAs or their local harm reduction advocates, whoever, to make those decisions. But in other instances, they're just making a budgetary decision like anyone else. They're saying like, hey, like we know this organization that does great work, let's send them the money. Or maybe they're saying, we don't really know for sure, and we're going to set up some kind of commission. Again, who's on that commission? Who's on that decision, that board or whatever that they decide to create? Is it a bunch of the usual players, or is it folks who maybe have some new ideas or have experience with the system? So to answer your question, they could very well just decide for themselves how to spend that money. They do not have to work with their SCAs, is my understanding.
Scary.
Yeah. I think it leaves a lot of opportunity, and opportunity in both directions, opportunity for advocates, opportunity for legislators.
Yeah. Thank you.
Mm-hmm. Tim.
Yeah, I appreciate the information. Thanks. Good stuff. I'm from Westmoreland County and I work for the county here. And I guess we're grateful that we're not giving the SCA control of the funds here. We are including them in some of our planning, and hopefully to put out some of the good work that we're planning on doing. I guess my question though is that we have some confusion here. We've asked for some clarification on this, and we're still not getting a direct answer. Can we or can we not spend any of these funds on administrative costs? Which would mean hiring some new people to carry out some of the duties that are going to be necessary. We just don't have the infrastructure and the resources right now to do all this, and so we'd like to, of course, bring some new people on board. And we're getting some mixed messages. So I'm just wondering if you have any clarification on that.
I should say, of course, I am not on a board of trustees, so I do not have an official answer for you. However, my understanding is that administrative costs, infrastructure, things like that are fine as long as it's part of this future, potentially past opioid remediation, but especially that future opioid remediation. So in other states, how I've heard it described is the funding cannot be used to recoup old costs. So let's say you have a program staff person and you lose the grant funding for that, then opioid settlements should not be used to just fill in that gap. It should be used for something new. Right. So maybe you want to hire a new outreach coordinator or something like that, who's going to be working on opioid remediation issues, then something like that is usually justified.
Okay, it makes sense to me. Thank you. I appreciate that.
Yeah. Any other questions from folks? Feel free to raise your hand or just unmute. Yeah, Clayton?
It's not a question I don't think I know the answer to, but just one I'll put out there anyway. The Exhibit E did a lot of, I think teased out a good amount of things related to this funding, but do you know if there was any conversation regarding the impact of the opioid, epidemic crisis, whatever you want to call it, on communities, and whether that would be considered a part of the remediation, if that's the right word? I think specifically around, and I know there's, communities across the state and all across the country, but I think about the community of Kensington specifically in Philadelphia, which is the most impoverished zip code in the most impoverished city, major city, like top, 5 or 10 cities in the country. And while I'm happy that if everything goes like I would like it to, there's more money around MAT access, treatment access, things of that nature. I also would say if you're getting $1.5 billion investment in that community that has basically been made to be like a wire Amsterdam situation, would also be something that they can do. We got smaller, better communities, or more, richer communities, for instance, that have their own cleanup crews. They have their own, like, trash cans. They have their own, things that improve the quality of life in that community. And I'm just wondering if there was anything that was said about that, because it feels like you're treating the symptom of a problem and not really the major problem in most people's cases, which is poverty, among a few other things, which I'm sure all of us can, gather together. So go ahead.
It's such an important point. You're completely right. And I think that's where this is where there is good opportunity. I think that this funding, it's like, because there's so little regulation of this money, it does give us an opportunity to be creative. And it's going to come down to those decision makers in the end of if they allow it or not. But if you are a county making a decision about how to use your funds, and you can make a really concerted effort to explain how funding trash cleanup is related to opioid remediation, or is funding various like workforce development issues is related to opioid remediation. Again, I think that the onus is going to be on those officials to make those arguments to the Board of Trustees. So as long as they can make a good argument for it and the Board of Trustees are on board, or maybe, I mean, for all we know, the Board of Trustees aren't really going to be heavy-handed. We don't really know for sure yet how they're going to act in these situations. But I do think it gives us a lot of opportunity for that kind of creativity. And with that said, from the advocacy side of things, whether or not, I mean, we all want a piece of this money, right? Like, we all are running programs or doing important things that need money. And take the money out of it for a second. This is all a really good opportunity to make the points that Clayton just made, that like, this is all part of a larger ecosystem. Money can only do so much. What we really need is XYZ kinds of investments, and that's going to take a lot more than $1 billion. Split up between however many counties are in Philadelphia or in Pennsylvania, excuse me. So it's also an opportunity to keep bringing up those issues and educating and advocating for the broader system changes that we need.
So, I mean, I'll throw out to the group, if somebody was to put together essentially a toolkit for how to reach out to either the SCA, the county commissioners, whoever is in control of dispersing the funding, what would people want in that? Or what other kind of support would you need to be able to do some of this advocacy within, your respective communities? So I know this is all very overwhelming.
Hi, Jordan. It's Kate. Can you hear me?
Yes, I can.
Okay, sorry. So I would like to have some kind of like evidence-based research to show like where the money could be best used. because I'm just so upset of where my county is wanting to spend their money. As you can see, I added it in the chat. So I would love to like just maybe brainstorm or just get like a one pager of ideas and like evidence-based treatments or just different things that somebody who actually works with people suffering from opioid use would think the money could best be used. Just something like that. And that's just for my county that I live in, because we are not very progressive in our thinking. So that's what I would like.
There are a couple organizations that did put together essentially like what they propose is, like the ideal roadmap for how funds should be spent. The kind of programs that counties and states should fund and the initiatives that should be started. If you give me a minute, I will at least find one of them. I haven't been able to do a super deep dive into it yet, so I can't give like thumbs up, thumbs down, thumb in the middle, but I will drop that in the chat for you.
We've collected a lot of those resources too, Jordan, which I'm happy to share, and you can share along. I will add there are a lot of national organizations who are interested in how opioid settlement funds are spent, who I think are doing a lot of really great work trying to do this education. So like the National Association of Counties is putting together a lot of documents on, the best ways to use funds. Johns Hopkins School of Public Health has been putting out like the opioid strategies, like the best way to spend funds. So there's a lot of these types of educational things happening with those larger decision makers. That said, we all know, like a lot of these folks, they either, I don't know if they never hear it or they're just wearing earmuffs all the time, or maybe some of them just don't care enough, as much as we wish that they would. And that's where it really comes down to like, it's a political process and you are their constituents. And there is an unfortunate responsibility that falls upon us once again to really push for what's right.
It seems to me it's a little concerning to me that syringe service programs and harm reduction is pretty new to Pennsylvania, but we've had a group of people that have been doing this for a long time. And I don't see a lot of those folks at the table, and I don't see any of those names on that list of trustees, people like Aaron Arnold from Prevention Point Pittsburgh and Jose Benitez from Prevention Point Philadelphia. I don't see Rosalie Danchenko's name up there. You have folks that have been doing this work in Lancaster for a long time illegally, who kind of have been through some of these and have worked with all the stakeholders, the community governance, the police departments, the county prisons, those medical practices that do a lot of MAT work and who do a lot of free work, free clinic work. And it just seems to me like we do have a group of people that have that institutional knowledge. And here we are at a new starting point. So we have the folks that have been struggling and fighting and scratching to put these services together and have been done a phenomenal job with nothing. And now all of a sudden we've got this, I was around for the tobacco settlement and I saw how it went downhill fast, and it worries me when I see how the structure of this thing is getting started already, because you already have a group of people there with the purse strings who have not been up to their elbows in harm reduction work. I mean, it's just suddenly a thing now because there's money there. So I don't know. It's very concerning to me, to kind of see how this thing's going at this point. And I just really would hate to see us miss this opportunity. I worked for the Department of Health for 4 years when they were starting the PDMP. They weren't willing to do anything to mitigate people going from a known oral administration of an opiate to dirt cheap, very pure heroin on the street of unknown potency and going to an injection route. And, we had to get the PDMP going, but couldn't put any monies there to mitigate, the hepatitis, HIV, and the overdose epidemics it was fueling. And I don't know. I'm just concerned. I mean, I think we really do need to pull together that group of folks that have been struggling in this environment for a long time. We don't have to reinvent the wheel. They have lessons and ideas. They know how to spend money to get the most out of it because they were getting it, by scratching and digging to try to find it. It wasn't like the government just come along and said, okay, here's some funds for you guys, go to it. So I really think a good starting point for whoever's putting together talking points is we need to be, maybe you have, I'm just, this is my first meeting, but and I'm Charlie Hauser, by the way. I'm a preventive medicine physician, and I was the viral hepatitis prevention coordinator for the state for about 4 years. But Jose and Aaron and those guys, they know a lot of the things that we're sitting here thinking about. I have a list of those people who are contacts for me. So I basically used 18 months worth of CDC funding for hepatitis to try to pull together grassroots HR and PA from 2015 to 2018. And there is a whole group of people out there that was doing this for a long time. So I really think that it's important we tap into that. But it's concerning to me to see all the politicians at the top of the food chain, so to speak, and the fact that it's being decentralized to counties whose politics are all over the place. Everywhere from, harm reduction is a dirty word to, you're facilitating drug use by syringe exchange programs. And, all these counties are at different stages of change, and each one of them is going to need its own public health plan in order to be the most effective. If we want effective HR programs that are going to endure and to really help save lives and, reduce infections. And so I would just throw that out as a thought that we really need to, if those folks have not formally been invited, that we somehow engage them and have them be a part of this as well.
And Charlie, one of many things I heard you say just now too is maybe it's like one of the PARN, I don't know if we're calling them demands or what, but one of the PARN asks is that every county has some kind of planning task force, something to really ensure that this is a thoughtful decision-making process.
There's 67 counties, and Pennsylvania is like several other states. We have two very bluish, progressive liberal regions, if you will, Eastern and Western. And then you got this whole gamish of people in the middle that are generally red, any way you look at it. And, maybe you don't have to do every county, but you could break the state up in regions and have maybe instead of 67 plans, you could have maybe 15. Yep. And maybe not be at the 9 ring on the target, but at least at the 7 or 8 ring, so that we're moving in the right direction. And again, Pennsylvania is like a lot of Appalachia. It's not unlike Kentucky. It's not unlike Ohio. It's not unlike Tennessee. There's lots of similarities, and we see this from the viral hepatitis prevention work we're doing, on top of the phenomenal increase in intravenous drug use driving hepatitis epidemics, but also the core. Even before fentanyl was a big issue, we were having big jumps in opiate overdoses because of pure heroin. Then when you throw fentanyl on top of that, it was like, I don't know, way more than gas on a fire. But those same situations are still there. And the solutions really are the same. It's how do you bring people along on those stages of change in a community basis. And, you know, you're going to have a lot of different solutions for different regions, and they're not all going to be the same. But there are people doing this work who've kind of done a lot of that already. So it's not like we have to reinvent the wheel.
Thanks, Charlie. Those are a lot of really, really good points. And I think, to that, there is a lot of education that needs to be done across the state. Everything from just your average person to, working specifically with educating the recovery community. Because overwhelmingly for majority of Pennsylvania, the recovery community is very conservative. Educating medical professionals, law enforcement, clinicians, and everything in between. And all it goes back to, funding, being able to secure funding and being able to, secure consistent funding. And I think this is where a lot of advocacy can come. As Trisha mentioned, especially with members who were sitting on the abatement council, they have term limits. What kind of campaign would it take to get our people on that council? What would that look like? What would it entail?
It's funny you said that. We had these conversations in 2015 and 16 when it was whether Governor Wolf was going to get a second term or not. And we were told to just kind of hang out, that when he got his second term, that, they would be finding money to do more HR stuff and that there would be a better political environment for that. It didn't happen. So this first go around, I don't know. I think it's going to be the wild, wild west, but in my opinion, it's set already. So we need to really be thinking about, like you said, the 2 to 3 year mark when stuff goes to turn over. What do we want to be doing then? Because I don't know that there'd be a whole lot of new stuff going on in the next year or two, other than counties just doing their own thing. And you see that already. I mean, what you've shown us is probably 10 different examples of what counties are doing, and they're all different. There's not one consistent one among them all. And and I've always said this in the talks, overdose doesn't stop at the county line. It doesn't stop at this highway. It doesn't stop at that river. Now, there's definitely hot spots like Kensington and Clayton. I feel your pain. I've spent a little bit of time down there, and in a situation like that, I think the answers are right in front of you. But when you still look statewide, there's a lot of things that there's a lot of similarities, but there's a lot of differences too. And it's to see what 10 different counties are doing different things with this money. It makes me wonder, if we're getting off on the right foot or not.
So I think, again, talking about, so what does that look like for a strategic, campaign, and being also realistic with expectations and goals. I would love to see Pennsylvania pass an SSP bill this year. However, there's some steps that need to happen before we get there. And that's just, the name of the game. Clayton, I saw you had throwing your hand up.
Yes, Charlie, really great points. And I definitely think that given the nature of Pennsylvania, which many of us know is it's varied. The hubs being Philadelphia and Pittsburgh, you can throw in Harrisburg and a couple other places, but knowing that, the more I'd like to think forward thinking is in those areas, but it struggles in the middle a lot of times, Northeast, Northwest, North Central. I think it's important that, and maybe this is something that Parn can work on, having like I don't want to say a Bill of Rights, but some type of declaration regarding some standards. Like, I like the region aspect, depending on how far that region goes. But tying in like what we would consider, let's say, rural and even suburban areas with places that actually are dealing with stuff on the ground and have some more thoughtful things besides abstinence only and one option for drug treatment. A lot of these counties, I could assume, either don't have treatment facilities themselves, or really overflow the treatment options that they do have. So can an organization like PARN help create something that says, if you can't do a treatment facility or have multiple treatment options for people in your area, then this is the mileage in which it needs to be. You need to have those type of spaces. I definitely know, I'm sure on the Allegheny side of things, county side of things, but also the Philadelphia side of things, we get a lot of folks, and I'm not saying it's the majority, but we definitely have a lot of folks who are coming from other neighboring counties because they don't have what they need in those counties. And, if I had a question for Trisha, excuse me, it would be, is there a baseline around those counties actually establishing something? Because it's one thing to take the money and, as Kate was saying, try to throw it in the guns and bulletproof vests. But like, do you have a methadone clinic? Do you have, Suboxone clinic? Do you have people that can prescribe naltrexone? Do you have places for people to stay? Inpatient, outpatient, homeless shelters. I know it depends on what the actual county is getting. Sometimes you won't have enough money to do that, but that's where that region of care would come into play. So you're not seeing the folks who are always gravitating west towards Pittsburgh and east towards Philadelphia because they actually have a relative ability to access a high level of options when it comes to care in their area, and not just like, oh, we can't do that, we don't have those capabilities, you're going to have to go here to get the help that you need, and that's it. I would say the same thing with syringe service programs as well. You may not have it in a smaller county, but someone should be able to access it within, let's say, an hour drive or something like that, whatever mileage that would be. That would be something I would think documenting, because in the end, if you don't have that, then you're just going to have, these smaller counties who are backwards or, not willing to change, continuing to do the same thing and just using the money, because of the lack of clarity of what's acceptable, to do things, that none of us think would makes total sense as far as I guess the opiate reprimandment. I can't, my words are jumbled, but I hope people get what I'm saying.
Mine too. It's too late in the night, Clayton. I shared a couple things in the chat based on what you had said. So I have heard of like the addiction treatment bill of rights. I've heard of the recovery bill of rights. I would imagine someone somewhere has done a harm reduction bill of rights. But I'm not sure if I have seen that in like a federal way, in like a national way, but you could certainly do like a Pennsylvania harm reduction bill of rights or something like that. And then to your point about like, what would we say is like, what kinds of requirements do we want? The National Association of Counties recently shared, I think just it's this week, this quick guide to conducting a needs assessment. So this is a resource for county leaders, like, how do I conduct needs assessment regarding what's needed in order to spend my opioid settlement funds? Like, it's all related. So that's a resource that already exists. I would suggest like sharing that with folks, and then again, boil it down to, what do you want? What do you guys think? What is PARN's? Maybe the national standard is that if you're within 10 miles, but you're like, at PARN, we believe that you should only be 1 mile away from XYZ resources. It makes it very specific for folks to at least have a goal to work toward.
Thank you, Clayton.
rather-
More good points, really good points. So, and we still have time for more comments or questions, state specific or, county specific.
Jordan, I hope you're saving the chat because folks are sharing a lot of good stuff in there.
Yes, I am saving the chat so I can also send that out tomorrow.
I just added some of those names of people who have been very active in this for a long time. And there's more. Those are the ones I'm just shooting off the top of my head. But there is a, we use the word institutional knowledge, or historical brain trust. Those folks there have years of working in this environment in harm reduction circles.
I think it would be interesting to try and see if we were able to, get from the abatement council, what criteria they were using to meet those list of suggested criteria. How
It
did you
seems to
meet
me
those
like-
boxes?
I'm sorry. Yeah, it seems to me like we're past this first round of trustees. We're going to have to start thinking about how are we going to, have our voice heard for the next round, because it seems like this is pretty much set in stone for 2 to 3 years, if I read that right.
The members are, but I think Jordan makes a
Okay,
good point that they have just all been appointed. So
Mm-hmm.
I imagine, I was told they have a meeting coming up at the end of March. I don't know the exact date. And again, I don't think it's public, but I would imagine at one of their first meetings, they're going to be talking about those kinds of processes. That's what we're seeing in other states with their various advisory councils. They have to come up with, okay, so the requirement, right, is that every jurisdiction has to provide an annual report. So is the trust going to do anything to encourage funds be spent in a certain way, or, advise that funds have to be spent XYZ, or are they only going to come back and punish you if you did it wrong? I imagine they're going to provide some kind of advisement. So there's room there to make that advisement a little bit more specific. And then when it comes to after decisions are made, those first reports are turned in, what's going to be their process for reviewing that? Are they going to require receipts? Do you really need to prove that? Or are you just sort of promising that it's been spent correctly? Those are the kinds of questions that still need answered that maybe you all could help influence.
And I think that's where doing some general education, about how do we utilize, the Sunshine Act, right? To get records from your county or, your SCI, because again, that's all things that we have access to, but, the process of actually doing it can be, confusing or not knowing, where to start for that. And I will add with the monthly organizer call that I host every month. That's absolutely a space where time can be spent organizing exactly what we have, all been talking about. Putting together that strategy and campaign for, well, what can we do different the next round of money? Yeah, and I'm in full agreement. Clayton put in the chat, if we don't get invited to the table, then we just build our own. I've got plenty of chairs I can bring, so.
It's been that way for a long time. Harm reduction typically is not at the table.
And make noise, right? That's a form of creating your own media right there. Create, say, hey, we tried to get at the table. They didn't invite us. They didn't accept us. So we created our own. And here's what we're demanding. This is how we believe settlement funds should be spent. That's how you make noise.
Well, we have a journalist sitting there in that list that's written some articles that catch some eyes. So maybe Aniri's interested in doing something along those lines.
Yes, I know some of you have heard from me directly, but thank you for letting me join you all. For those who don't know me, I'm a reporter with Kaiser Health News, and I used to be based in Philly and in Harrisburg, so spent a lot of time reporting in Pennsylvania, and um, I'm really interested in holding folks accountable on this opioid settlement money, and so I'm tracking a lot of the same stuff that Trisha and Jordan and all of y'all are tracking. So I'll be poking around, and I'll be, reaching out to folks as I write about this. But certainly, if you all come across things that you think should be getting more attention, should be, have a light shown on them for what's happening, please feel free to reach out. I will drop my email address in the chat.
And again, join our listserv, check out our database. If you all are at a county council meeting and a decision is made, share that information with us and we'll put it in the database. Aneri is not the only reporter who is interested in this, although I think she got kind of the foothold. But there are other reporters, national and local, who are really interested in this. And I think especially if we can make that information easy for them, like that the database is an opportunity for reporters to say like, hey, like these decisions were made, like this could make for a good article. So we're hoping to bring that kind of attention to it with that tool as well.
Yes, thank you, Aneri, for diving into this topic. Media is a powerful tool for both good and bad, as we are unfortunately seeing every day. Also want to, throw out there with starting with, calling your county commissioner or your SCI, depending on who's handling the funds, and asking, are you creating a community task force or advisory committee? Some counties are, some counties aren't, some counties are being super transparent, others aren't. So starting there and finding out, is there an opportunity locally that you can influence by either being on that committee coalition yourself, or making sure that the right people in your community are at least getting a spot at a local level. And Trisha's right, this is a time to make noise and be strategic. That's how I think probably every major advocacy movement has gone. So, and I will, as I come across information, I'll send it out through the listserv. So if you're not on the listserv for PARN and you want to be, just drop your email in the chat so I can add you. I will be, as soon as the Abatement Council publishes their public meeting schedule, because they'll be doing meetings that are open to the public and also meetings that are closed. And that was discussed during the last DDAP advisory meeting last month. So as soon as those, that information is published, I'll send that out to everybody as well. And whatever support folks need locally, community education group is a phenomenal resource, especially in this area. And PARN is, willing and available to support in, whatever capacity we can be.
Maybe there isn't an answer to this question, but I'm just curious. It really seems that DDAP is kind of the lead agency on this. I see very little coming from the Pennsylvania Department of Health. Is there a story there, or is that just kind of how the chips fell? Or
It's a great question. I think one thing that we've been noticing too at CEG, we often talk about this endemic of HIV, viral hepatitis, and substance use. And it's been obvious that you look at even Exhibit E, there is room for things like funding for HIV and viral hepatitis, but it's not very explicit. And I think that your average public health folks are not being brought to the table. And unfortunately, in a lot of states, we still very much have this siloing of public health versus behavioral health, which particularly when it comes to drug use is just so incorrect and creates a lot of red tape where it doesn't need to exist, or that causes a lot of harm. So I think you make a good point. Like public health folks do need to be at the table. Local health departments should be a part of these conversations in the same way that we're talking here, right? Like if they're not being invited to the table, they need to be speaking up. Like they are their own kinds of authority figures that can make a big difference in these conversations. So if you know folks in those realms, you know, to speak from that experience, like I think that's totally relevant.
You know, one of our mantras was, how do we keep people alive and uninfected so that they can be ready and have the services they need to recover. And, you know, the vast majority of people who do recover get no services at all. 80, 90%. They don't even go to a 12-step program. They just stop.
Mhm.
But, you know, there's a group of folks who, you know, have a not only huge risk for overdose, but other diseases along the way and other things that affect their quality of life. Things I like to call the unintended consequences. And I don't know that you can talk about one without the other. They're the same.
Mhm.
You know, it's government that does the splitting. And what that does a lot of times with that splitting is that it makes programs much less effective.
Absolutely. And I think that
You
kind of
know,
goes back
it's like
to
a divide and conquer kind of thing when
Mhm.
really we need to be unified and work together. And it really comes down to money. Who controls the money?
Mhm.
And, you know, so often that is part and parcel why programs fail, or they're much less effective than what they could be.
That reminds me too of Clayton's point of like, there are so many other broad concerns that are contributing to what we might call the opioid crisis or the overdose crisis. And again, this is an opportunity to think creatively, like how can we get funding for, and how can we generally educate and advocate for this larger ecosystem of care? Some people call it a continuum of care, an ecosystem for recovery, and there's other terms I'm missing. But I think these things are all connected, and the more that we can talk about it as like a larger infrastructure issue, I think that can go a long way.
And I'm not sure that your county government's the best ones to make those decisions. It's like this is something brand new for them. You know, they haven't even been in this space, and all of a sudden now they have the money to spend, and they're trying to do the best they can. But they're not very well informed, and they have a bunch of other voices in their ear, a lot of which is law enforcement.
100%.
They understand law enforcement a little bit better. They understand county prisons better.
Yep.
They kind of let the single county authority kind of take care of the drug and alcohol stuff. They're not really involved in public health much at all. And now all of a sudden they've got all this money.
100%. And again, that's why we say like this is a political process. It's, you know, the same thing is happening at the state level all the time, where you have these legislators who are not topic experts in a lot of the things that they are creating laws around. They're not topic experts in a lot of the things that they're appropriating money around. And the same is at the county level, if not worse, right? Because like, depending on how the county, if your county is like a part-time council, they've got other things going on. It really falls. I mean, what I wish would happen is that these folks would understand where their weaknesses lie, and that they reach out to experts to educate them. And sometimes that's what happens. But sometimes it's just another budget decision they have to make, and they spend 5 minutes talking about it, and you know, there goes $200,000 to this other program. Again, maybe that was a good choice, maybe it wasn't. But the more voices that they can get in their ears, at least they're more informed in the different options.
Most are learning what they know within the last 30 days. They haven't done a whole lot of study on this over the last 4 or 5 years, you know. And I don't know. When I look at that list of trustees, I don't know all those folks, but I know they haven't been in the circles that I was around. Now,
Yeah.
I was down there 5 years ago, but still, it's like I don't remember these people as being subject matter experts in regards to this stuff, and it's just like this is the next thing. So I guess I better learn about it because I'm going to have to be, handing this money out. That's concerning to me.
It's so true.
We are coming down to the hour. So I want to leave a minute or two for any final questions, comments. If anybody has any, again, I'll be sending out the link to the recording. Also kind of the wish list that has been put together, for the last like half hour, all the comments from everybody. And again, we'll send out, that meeting schedule for the abatement council when that becomes available. So, I want to thank everybody for attending, taking time out of your Wednesday evening after probably working all day. Also thank Trisha for taking time out of her Wednesday evening to be here. Much appreciated. And this is a topic that we can, I can continue to host guests on during the monthly organizer calls and really make the most out of that time every month. And if, as per usual, if there are ever topics that anybody is, interested in, please let me know. And I will, make sure that, we're able to bring that person on. So any final thoughts or anything, Trisha?
Thank you all so much for having me. Happy to be a resource. Feel free to reach out.
All right. So I hope everybody has a great night, a great week, and I hope to see you on some future calls.
Night.
Thank you, everyone.